Imagery techniques are one of the relaxation strategies that invariably we like to teach kids. We like to teach them all of them: progressive muscle relaxation and breathing techniques and autogenic self-hypnosis, self-suggestion techniques. And ultimately what falls out for a youngster is their greatest hits, what they like the best after they've learned them all, they've been on tape, they've practiced them, they distill it down to something that is a neat package they can export to the classroom, to the baseball diamond, to the soccer field, to the dance practice, etc.
It's really generalizable then.
Yes.
The four flavors then are the imagery.
Right. The more active progressive muscle relaxation techniques.
Progressive muscle.
Yeah.
And autogenic.
Right. Autogenics and breathing techniques.
Breathing. Okay, that's not. Yeah.
Well, maybe we've jumped to techniques, but is there some kind of a sequence that you use when you see patients or clients? I mean, how do you start it out, and do you follow steps?
A very common occurrence in my work is for a family to be experiencing a child going through a chronic illness. And at times the chronic illness consumes the family resources. And there will be siblings in the background that we see but don't really get all that involved with. But we often hear from parents the description, she's been a saint through all this. We have spent so much time in the hospital. We are constantly going to appointments. Their blood draws. It's unbelievable. We're dropping her. We're here and there. And she's just been wonderful. She's absolutely my rock. And then when the family gets through the crisis with the patient, the chronic illness, and it took me a long time to learn this, probably a good 10 years working at Children's Hospital in particular, usually that sibling will eventually say, unconsciously or subconsciously, it's my turn now. In this case, it wasn't that this Nicole's older brother had a chronic medical problem, but he had a fairly significant behavioral issue that required a lot of mom's time, and it required a lot of time from the mental health system just to figure out what was going on and how to provide adequate treatment. He's getting good treatment now, and mom feels better about it, but suddenly her daughter decided it was her time.
Is there anything specifically that our viewers should look for, either in you or in the interaction that goes on?
I think I would just caution the viewers that the patient is 6. When I learned that, I knew immediately that I needed mom there. In fact, however, the patient had been prepared. Nicole had been prepared for being interviewed by this big adult male from fortunately I have a Midwestern, I think I still have a Midwestern accent, not a Boston accent.
Yeah.
No?
You're at least from out of town, though.
Yeah, that's for sure. And but that could have been a very imposing deal for her. I think she probably would have handled it. I would have been, as I call it, behavioral dentistry. I would have been pulling teeth to get things out of her in time. But I set it up, and I think it was to the relief of mom that I think you need to be in the session. It turned out, I think, that you'll see that the work I did cognitively, I would ask you to look at mom more in this session.
Well, let's watch.